Hello everyone, my name is Romaniel Hernandez and I'm here today with Megan Panikar and Alexander Martin to present our proposal for adopting a different curriculum model for our BSN program at UNLV. As current faculty members here at UNLV, we believe there is a need for change to our current curriculum. As we are aware, a well-conceived curriculum is essential to effectively prepare students for nursing practice. Today we will introduce two different curriculum models, the competency-based curriculum and the concept-based curriculum. We'll discuss what each curriculum entails, examples of programs currently using each type, as well as advantages and disadvantages for each framework. I will now hand it over to my colleague Megan, who will go over the competency-based curriculum.
Thank you, Roma. Let's first discuss what a competency-based curriculum is. A competency-based curriculum is defined as an educational framework that integrates its design and implementation on the intended performance characteristics of healthcare professionals. This curriculum design differs from traditional curriculum by placing emphasis on knowledge, skills, and attitudes applied by students. Competency-based curriculum provides clear, observable, and measurable performance criteria and outcomes for students to achieve. For this framework, the priority is the mastery of competencies vital in different areas of study and discipline. So how does the competency-based curriculum work? This outcome-driven framework works by having students put their newly acquired knowledge to practice in various settings to solidify the connection between theory and learned skills by consistently assessing their performance. NURS educators design their evaluation and criteria for success around coursework in the didactic setting and practice opportunities in the clinical setting that allow them to observe and measure student performance and competencies that are influenced by national nursing organizations such as the American Association of Colleges of Nursing, AACN, the National League for Nursing, NLN, as well as the Quality and Safety Education for Nurses, QSIN competencies. In this curriculum, learners are responsible for their own learning and are required to use the knowledge gained to guide their decision-making, reflection, and analysis of different scenarios. NURS educators and learners can then use competencies to track students' progression towards attainment of intended goals and outcomes, provide feedback on areas of improvement, and recognize successes. This is critical for nursing students to effectively develop the skills and knowledge essential for professional nursing practice. Competency-based curriculum can be found in various professions and is offered in over 200 different programs around the U.S. Many healthcare-associated schools use this curriculum, which include nursing, medicine, pharmacy, physical therapy, respiratory therapy, and others. This curriculum type can also be found in many colleges and universities from nonprofit to for-profit schools within the U.S. For example, the type of curriculum is used at the University of Rochester and University of Maryland Schools of Nursing, to name a couple. In addition to clinicals, they implement more case-based learning, role-playing scenarios, and simulations in their curriculum to provide realistic clinical practice, promote collaboration with peers, stimulate problem-solving skills, and improve clinical nursing judgment. Additionally, the AACN recommends for nursing programs to provide consistency in curriculum and skills among nursing graduates. They also mention that nursing employers are increasingly expecting graduates to have learned certain skills and depth of knowledge. Providing a competency-based curriculum would help guarantee that these needs are met. Therefore, a major advantage for organizations is that the AACN explicitly supported the competency-based curriculum in its 2021 updated version of their essential recommendations and competencies for nursing programs. These recommendations will help guide nursing curricula in order to effectively prepare nursing students for future professional practice. In turn, if more programs follow these recommendations, there will be more consistency throughout the nursing programs in the graduate outcomes. Competencies can also be modified to meet the updated standards set forth by accrediting organizations, as well as to reflect the needs of the healthcare community. Additionally, this educational framework aligns with the cognitive skills required to pass the next-gen NCLEX, which is focused on clinical judgment and decision-making. Competency-based education promotes active learning, especially in the clinical setting, and can have students engage in recognizing and analyzing cues, taking action, and evaluating outcomes to aid in developing their clinical judgment. Advantages of the competency-based curriculum for students include having a learner-centered approach that encourages students to understand how and why they are learning, which helps them to make connections between content. This curriculum moves away from the traditional lecture-based curriculum, where students have often relied on rote memorization, which wasn't effective for long-term clinical practice. Instead, competency-based curriculum emphasizes the importance of active experiential learning to develop and master a wide set of competencies, testing clinical and problem-solving skills. It improves clinical judgment and increases student engagement with an active learning approach. As previously stated, it also prepares students to pass the next-gen NCLEX. Lastly, having new graduate nurses with consistent skills and mastery of competencies across the board will help stakeholders have confidence in these students' transition to professional practice, which in turn helps these students get hired in a competitive job market. Now let's talk about the disadvantages of the competency-based curriculum. The major drawback, especially for smaller nursing schools, is the lack of clinical site placements. In the Las Vegas Valley, we have over 7 nursing schools competing for clinical sites, which makes it more challenging to provide diverse clinical experiences for our students. When clinical sites are not available, nursing schools try to compensate for lost clinical hours with an increase in simulation hours, which can be very costly depending on the facilities available to us. Lastly, it is labor intensive for faculty to try to create standardized assessments, and faculty may find it difficult to navigate this type of curriculum. Luckily, the AACN provides webinars and faculty development workshops to help prepare educators to teach using the competency-based curriculum. Now my colleague Alexander will discuss the concept-based curriculum.
Thank you, Megan. This brings us to the concept-based curriculum. I believe in order for us to better understand concept-based curriculum, it's a first good question to ask ourselves why it was made. So transitioning into the 21st century dawned the birth of the internet. Scholars now call this time period the information age. And with so much information at our disposal, educators encountered a problem. What happens when all the material is relevant? And so concept-based curriculum really is the answer to this question. So, simply put, concept-based curriculum attempts to help learners by managing information overload and creating an active learning environment that is directly opposed to the passive learning environment that exists in traditional lectures. So, I'll explain it a little bit further, but essentially gone are the days of a teacher lecturing and being the source of information, and in are the days of students actively participating in class and the teacher being more on the sidelines. Concept-based curriculum also uses 2 key terms, so concepts and exemplars, which I will explain in the next slide. So concept-based curriculum, how does it work? So for this, I like to draw a comparison between the traditional method of teaching nursing students and the concept-based curriculum method. So traditionally, you might have a topic such as hypertension, which would be taught in like fundamentals. And with that, the teacher might emphasize knowing the signs and symptoms, knowing the different parameters as to what constitutes hypertension. But the main idea is that it's focused specifically on hypertension. What concept-based curriculum calls for is to instead zoom out and understand that there's an overarching concept here of perfusion. And by doing this, as students learn the other exemplars, they're able to relate it all back into perfusion, which is essentially how they make deeper connections. This table is a great demonstration of how concept-based curriculum works. I took it from another nursing program, and so their information is available in my sources, but it's Barrett et al. 2023. So what this is showing again is this overarching concept of perfusion, and now we can see inside of here the different exemplars of that, right? So for example, a first semester nursing student might be focused on hypertension versus a second semester nursing student might be focusing on how perfusion is present in acute coronary syndrome and things of this nature. So again, you have the topic of perfusion being the concept, and then these sort of subtopics being the exemplars of perfusion. So concept-based curriculum is being utilized by numerous programs. And so differing associate and bachelor degree nursing programs across the United States are using this. Some that I quickly found through Google searches and things of this nature, readily accessible information. University of Portland, Oregon has a BSN program that's centered around a concept-based curriculum. In addition to this, our UNLV School of Nursing has now incorporated concept-based curriculum for some of its courses. Within Vail Community College, all the way in Virginia, has an associate's program that uses concept-based curriculum. Concept-based curriculum is actually not exclusive to nursing. In my search, I actually discovered that my old public school district back in Stratford, Connecticut, so we're talking kindergarten to 12th grade, actually uses concept-based curriculum. So really it's being utilized in all facets of education. So the advantages of using concept-based curriculum. First and foremost is that it's a learner-centered approach. Like I was alluding to before, we are gone of the idea of sage on a stage, right? We are gone of the instructor knows everything and is just dishing out that information. Instead, with concept-based curriculum, we're looking as instructors to be guides on the side. We're here to help facilitate learning. We're here to even learn from our students and to learn from what they develop in their group work, right? So one of the examples of using concept-based curriculum is this idea of flipped classrooms, where students do work prior to class and then in class they do group work. So this would be an example of how an instructor would function in that they would help facilitate that group work, perhaps answer questions that the group may have, right? But initially the group is the one coming together. And by doing this, they're forming deep learning, they're utilizing clinical judgment, they're forming connections between concepts, things of this nature. And so again, we're moving away from traditional curriculum, which really emphasized and really championed memorization, like just brute memorization. So additionally, the advantages demonstrated by concept-based curriculum is that it improves student satisfaction, it improves graduation rate, and it improves NCLEX pass rates. And these have all been demonstrated through peer-reviewed articles. So concept-based curriculum can have its disadvantages. Of course, it's difficult to implement, right? So there is, of course, the question of what concepts or what topics are most important to include, right? And which is the whole reason why it was developed, is this information overload, right? And how to organize those topics. In addition, faculty may have resistance. We are essentially asking them to change how they do their teaching. And anytime that you ask somebody to change something that they feel has been reliable for them for a long time, they're going to have skepticism. But as we've demonstrated, statistically, it's proven that concept-based curriculum works. Next, I'll be passing the torch on to Roma, who will give us some final thoughts.
Thank you, Alex. Here are our recommendations for moving forward. Overall, there are pros and cons to using both curricular models. We believe a hybrid combination of both would better provide a well-rounded education for our students. Considering the AACN and the NLN have called for teaching methodologies that will challenge and prepare new graduate nurses for the transition into professional nursing practice, here at UNLV we can develop a hybrid curriculum that incorporates concept-based teaching at the didactic course level so that students develop their critical thinking and stop relying on rote memorization, and combine that with competency-based learning so that students learn how to effectively transfer their knowledge and skills into safe professional practice. Since the AACN has fully recommended the competency-based curriculum, we can develop a hybrid curriculum model that favors the competency-based framework while still keeping some aspects of the concept-based curriculum. Additionally, we can have faculty participate in development workshops that will better prepare them to instruct using this model. Ultimately, our goal is to provide a better learning experience for our students, a more seamless transition from our current curricular model, and to help propel UNLV's BSN program to new heights. Lastly, here's a list of our references. Thank you for coming to our presentation, and we'll now open the floor for questions or comments.